Hello and welcome everybody to this Strong Lines vlogcast. We had the pleasure of catching up with Lou James, pioneering force behind PINC STEEL, educating physios in cancer rehab and making a difference to thousands of cancer survivors, helping them rebuild their bodies, minds and lives after a cancer diagnosis. In this episode, we talk all things PINC STEEL, Cancer Rehab Awareness Week, and what the PINC STEEL Foundation charity can do for local survivors in your area. Enjoy. Hello, Lou.
Hi, Fred.
Good morning. I've interrupted your breakfast.
I don't know, it's very good. I'm very happy to see you, Fred.
Well, it's lovely to have you on. It's a great honour. I hope we can talk through a few of the amazing things that you've achieved with PINC STEEL and raising awareness for such an amazing cause, and then talking about the foundation. So yeah, I think we'll lead in with the first question, which is, what is PINC STEEL? Where did it come from, and where is it going?
Ooh, good question, Fred. Well, PINC STEEL basically it's a social enterprise, and we're on a mission to reduce the burden of cancer globally through access to physical rehabilitation services. So we have a couple of parts. We have a training academy where we do postgraduate training in oncology rehabilitation, and we select experienced physiotherapists and occupational therapists worldwide to do that training. And we now have a network of therapists that provide one-on-one cancer rehab services and group cancer rehab services in 18 countries. So PINC STEEL is really about educating and helping to improve the cancer rehab services worldwide. We also have PINC STEEL foundations, and the goal there is to try and reduce some of the barriers to cancer rehab services worldwide and make it more accessible to more people. So that's really PINC STEEL in a nutshell. We really want to try and reduce the burden of cancer globally. And this is because the treatments have got so much better now. More and more people are surviving, but more and more people are being affected by those cancer treatments, and living well is not easy. So that's how we're trying to do our bit to reduce the burden of cancer. PINC STEEL was started in 2005, and I had my own physiotherapy clinic like you, Fred, and I started seeing a number of people affected by cancer, and they did not have any rehab support. And I really wanted to help them. I really struggled when I saw how much the cancer treatments had impacted their lives and how little support they actually got in terms of getting back to living and they didn't know how they were going to get back to work, how they were going to cope living again, even though they were now cancer free. So that really spurred me to really want to help this demographic more. And, you know, in New Zealand, this was a really in complete contrast to what our athletes were receiving. So in New Zealand, we're a really proud sporting nation. We look after our athletes, but unfortunately, we weren't doing the same with people affected by cancer. I didn't think that was fair, so I wanted to help. So that's where it started. You know, you asked where it's going, and I think, well, the numbers of people getting diagnosed with cancer each year is growing. And as I said, the treatments are becoming more effective, people are living longer, people are surviving for longer. And our goal is to make sure that no one misses out on cancer rehab support. And that means educating more cancer therapists so that there's a more global spread, there's a geographical spread, because people get diagnosed with cancer in every region. And also to increase funding for this essential service, because we know there's a gap there, we know people are missing out, and we really want to try and make an impact to more people worldwide. I think, you know, oncology rehab is a field which is not focused on the disease, it's focused on the individual and helping them, and that's really our goal, is to make sure that we're helping them effectively for when they need it. So what we've found is people need cancer rehab services, you know, immediately once they've been diagnosed with cancer, to understand what they need now to do to keep themselves well during treatment and cope with that treatment and get through that treatment the best they can. People need cancer rehab services once that treatment is finished, you know, because they then get a lot of side effects after that, and they really need help to get back to living their best life. And then we've also found that people need this for a long period. So the side effects of cancer can occur years down the track. So we don't want to stop that service too early. We want to make sure that there's options for people that they can pick it up later down the track if they need to. So that's where we want to go. We want to make sure we are providing a quality, comprehensive cancer rehab services that really supports all the needs of people affected by cancer.
Amazing. So yeah, how was it when you first realized there was this whole patient group and you realized your skills as a physio could really, really help these people, and that it wasn't really being done, was it? You just stepped in and went, right, we're going to do something about this. Yeah, incredible. I suppose you'd have met so many people on this journey. I wanted to see if there were some real standout kind of maybe business stories or personal stories and professional stories that stand out from that journey of bringing people from just rebuilding them back to living their best life.
Well, yeah, I mean, there's been lots of stories. I think the most rewarding thing for me now is seeing the patients and seeing those transformations, but also hearing from my physios and clinicians worldwide about, the transformations they are having. And I think that's the thing that drew me to keep working in this field and keep pushing to try and improve the services, is that I have seen so many transformations. So I've seen people that have been really depressed, really anxious, really deconditioned, and really struggling with where they're at, and then able to change, and seeing that hope, seeing that light go on, seeing that vitality is so inspiring to be involved in. I think probably my favorite experiences occurred quite a while ago now, and I managed to encourage two of my patients that had breast cancer to run the Great Wall of China Marathon. Now, I can remember ringing them up, and I was their physio, and I had helped them, and they'd got through their treatment, and then I said, I've got this idea. And I totally thought they would say, what? But they both went, let me ring you back. And then they both said, yes, we're in. And I was so excited because they weren't runners, but I knew that, having a goal and helping them achieve that goal would be really beneficial for them.
Yeah.
So we set out to run the Great Wall of China Marathon. If you've never done it, Fred, it's one of the most challenging marathons because it has over 3,000 steps, and it's in rural China, so it's a bit of a challenge. Anyway, so I got these ladies, and we did our training and we built them up.
You did it with them?
Yes, I did it with them. And I actually carried a camera, which was back then, the cameras weren't that small, and I wasn't very good on the camera, so the camera footage is terrible. It's all like that. Anyway, it was the most amazing experience. At times I thought, oh my goodness, this is a really big challenge, but we did it. And the most rewarding thing for me was to see them and hear them at the end. They were so proud of themselves.
Yeah.
They had achieved something they never thought they would do even before they were diagnosed with cancer, and then they were able to do that afterwards. And we raised money. We raised over $20,000 for our foundation in New Zealand. And so a lot of the women had donations from their friends and family, and everyone was proud of them. So it was a really awesome thing to be involved in as a physio in this field, is helping people achieve their goals. And I think that's what all of our physios do. You don't have to have a goal of a marathon, but all our physios and occupational therapists are helping people achieve those goals, and being part of that achievement is just the most amazing thing, I think.
That's amazing. Great Wall of China. So I'll add that to the bucket list.
do that, Fred. When you're allowed to go to China, it might be sometime.
Yeah, blimey. What about as well from a business side of stuff? Because you've obviously cultivated an incredible company that's providing amazing services to the entire planet, and you're able to do it virtually, so it's not affected by COVID and things like that. What about a sort of business success or something that you overcome with the company?
So I think that's one of the challenges has been in this field, is that there are a lot of barriers. And when I talk with clinicians and experts around the world, there are a lot of barriers to people affected by cancer and to people trying to provide these services. And I think one of the things that I just haven't given up. So I've just kept going, had a few knocks, but keep going. And I think it's really exciting now to see other people's successes for me. And I suppose, the stories that resonate with me are when I help train a therapist to do this work, they find it just as rewarding, and then they have that success. So I've had physiotherapists that have been musculoskeletal therapists that have worked in private practice and really not seen any oncology clients, to seeing, to then training, huge amounts of other members in their staff to do this work, and having a really great team that are regularly seeing oncology clients. And then a lot of those clients really feel the reward of that work, and they keep coming back. So they have classes for them, they have things out on the water, we do paddleboarding, and they provide a whole range of services, and then that creates this really supportive group that support that clinic and support other people going into that clinic. So the patients then encourage other patients, you need to go to this clinic because this is where you can get really good support. So I suppose it's those stories I've seen where the clinics have got a whole community that really support their work. And that's one of the things that I think is really beneficial with the foundations, is that it can create that support network around clinics.
Yeah, definitely. There's it's something definitely can be learned in terms of the musculoskeletal side of physio tends to be very, one-to-one, people come in, come out. When it's oncology rehab, there's just this bonding, and people are happy to get together, share stories, push on together, make a social and a team effort out of it. It's amazing.
Yeah.
It really brings people together.
One of the physio stories that really resonated with me this year was one of my therapists works with oncologists, and she started an exercise program and works with these oncologists, and then she decided that she'd set a goal of the team going and doing an event, and I think there was a 5K, a 10K, and a 21K, and you could walk or run. So people chose what one of those they wanted to do. And in her team, she had people that had just completed their chemotherapy. She had oncologists, and she had a lot of people from that whole business went. And one of the things she said to me is the oncologists just loved it, because they had never seen their patients out there doing things like that, and saw how amazingly rewarding it was for them to achieve something. And so instead of just seeing them in their rooms, in their offices, not feeling well, you get to see them in their real life achieving things. So I think that's a really a great thing to be able to do for oncologists as well as your patients.
See the kind of end product of all that hard work. Yeah. So leading that onto CRAW, Cancer Rehab Awareness Week. This is big, coming up on the 7th of September, 7th to the 14th. Very exciting. This has been a huge project, I imagine. What is Cancer Rehab Awareness Week? Kind of says it on the tin bit.
Well, we decided that the biggest barrier really for cancer rehab services worldwide is a lack of awareness. People do not put cancer and rehabilitation together. They don't understand what it's for, and I think the focus with cancer is on the treatment. And the treatment is vitally, vitally important. But there's not much chat or talk about recovery from it. So Cancer Rehab Awareness Week is really to spread as much information as we can out there about the benefits of cancer rehab, so no one misses out. And it's to help encourage people. I mean, everyone knows someone affected by cancer, unfortunately, because the numbers are so high. But it's to encourage people to support their loved ones, support their family members, support their neighbours, their colleagues, their work colleagues, that if they've had cancer, they should be getting cancer rehab, so that it's more talked about and it's more accepted, and people are looking for it in their communities. Because there are now a growing number of people like you, Fred, that are in your communities. You've got the skills, you're willing to help, and people need to know you're there. So that's really what it's all about.
It's definitely, it's almost, you say about the cancer treatments improving, it's almost created this problem, hasn't it? Because so many more people are surviving. It's now, right, how can we get that survivorship? How can we get that quality of life back and rebuild? And saying it's all right, it's safe. And also the loads of the research that's sort of coming out during the positive effects that exercise can have during treatment, and so there's more treatment completion, less breaks in treatment. It's vital that people realise how important this is. Like, what are some of the barriers? We talked about barriers earlier. What are some of the barriers to people accessing the service, and how have you overcome those, particularly in New Zealand, that we might be able to reproduce in the UK?
I think some of the big barriers are the effects of the treatment itself. When people are having cancer treatment, it's all-consuming, it's overwhelming, it's extremely distressing. It affects every system in their body. They don't feel necessarily like going out and having an appointment or getting into exercise can be the last thing that people feel. So you've got to realise that actually for someone going through cancer, it's a really tough time. And again, that's sort of why we're really keen on pushing Cancer Rehab Awareness Week, is because often they'll need encouragement, they'll need help to get to those services, so that's a really big barrier in itself, that you don't feel great. And again, that's one of the reasons why we think being proactive and going early is the best thing. Not waiting until you're suffering, not waiting until you've got disability and really struggling, but going earlier so that we can help you get through that treatment. So I think, a big barrier is the effects of the cancer treatment itself. Other barriers are just people don't know that the service is there. It's taken a little while for us to educate other healthcare professionals about what cancer rehab is. And oncology medical professionals are doing a fantastic job at helping people survive cancer. It's a very complicated disease. There's over 200 different types of cancer, and they all manifest differently in each human. So it's very different. Even people with the exact same diagnosis can be treated in different ways. So the oncology medical experts have a very complicated, complex job, and they're keeping people alive, vitally important. So their focus is on that, and our focus is on the recovery phase, which is different. So some of the problem has been in the gap between the service delivery and then how do we have a pathway down to rehabilitation. So that's been some of the barriers. So how have we overcome that? It's really down to our clinicians really going out and spreading that message to the people in their region that can refer patients to them, to the support groups. There's a lot of support groups out there that support people affected by cancer. It's talking to them and it's getting the message out there so people understand that there is a service available for them. And now I think because we've helped more people in New Zealand, we have a lot of the patient voice is really strong. So we have a lot of people backing what we do and telling other people, I did this and it was amazing. You should make sure you get that support.
It's very telling, isn't it? When you say you've got PINC STEEL delivering training to people all over the world, it's a global issue. It's a global problem. Lots of therapists and oncologists and patients all recognizing that this is an area that needs to be shouted about, and the education side of it as well. And sometimes, obviously for us in private practice, I think it's probably similar to yourself in New Zealand in terms of that probably funding for it as well, the access in terms of people having this, knowing about it, and then being able to fund their treatment, which is then where the wonderful PINC STEEL Foundation comes in. So can you tell us a little bit about the foundation?
So I think one of the big things about when people miss out on cancer rehab services is that they suffer unnecessarily. So they suffer unnecessary disability, they suffer physically, mentally, socially, getting back to work. So there's a whole lot of suffering that goes on if they don't get it, which is why we've started the foundation in the UK to try and prevent that and make sure that people aren't slipping through the gaps. There is support for them, even if they can't financially afford it, they can go to cancer rehab services. So it's really to try and prevent unnecessary suffering. So, people in the UK we've found are missing out on these essential services, particularly after they leave the hospital system. They often are all right for a point, and then they, get more and more affected by their treatments, and they don't know where to go. So I think in the UK and in Ireland, it's vitally important that we help try and fund and support these people better to be able to get to these services so that they can live after they've had a cancer diagnosis. I think too with COVID, that's going to impact the UK and all over the world, our cancer communities even more, because they are missing out on some of those services that they should be getting, because some of the services have stopped because of social distancing and they are often immunosuppressed. So some of the services have stopped altogether. And I think it's really important time now for the foundation to start supporting people so that they can get those services that they require. We have over 100 certified specialised cancer rehab physios in the UK and Ireland now. And it's just awesome. They're working together. They're trying to support their communities. And it's fantastic that they're all getting behind this foundation, because at the end of the day, you are the key assets to trying to help the people in your region. And we need more people to get behind our therapists like you, Fred, to make sure we've got the funding stream to support these patients.
It was great. I think we only put the Just Giving page out there last week as a post, and already people are donating things, which was really exciting to see, just the sheer support coming out of the community. But yeah, we're looking forward to building a few more fundraisers and getting the Midlands doing what we can. We've got there's the Thames pathway, isn't it? Wow, that's huge. Like 230 miles, I think they're going to walk in 5 or 6 days, 4 or 5 days.
Well, no, they're doing it as a relay. So they all add up their time, and that's again to be able to socially distance. They can do it, and they're going to add up that, which is great. I'd love to come over and do that too, Fred.
I think the China wall will suffice for the moment. Now, okay, what about in terms of oncology rehab, and just kind of where the kind of birth of this came from, and was there a breakthrough, a bit of a eureka moment that people started really realizing that this is something that needs to be looked at, and just the researchers delved into this and it all kicked off?
So I've been working in this field for a while, and I think that the biggest breakthrough I've seen over that time is the amount of quality research and evidence now that shows that cancer rehab and exercise rehabilitation is so important. So there's been a significant amount of funding put into researching the needs of people affected by cancer, which is great. So, and now there's significant research to show, look, there is a need, and this stuff really does help, particularly in preventing long-term consequences of cancer, also preventing a cancer reoccurrence, so the cancer coming back, and also in terms of survival rates. So it's very, very important research in terms of what's going on now. So if you look at the research now, there's been over 2,500 randomized control exercise trials that have been published just focusing on cancer. And so there's now more evidence on the benefits of exercise oncology than there was for heart disease when cardiac rehab became a standard practice of care. So that is amazing. So, everyone knows if they have had a heart attack that they need to do cardiac rehab, and there's a pathway for that. There's now more evidence in exercise oncology. So I think that's really, really exciting that we've got the evidence there, and we've now got the practitioners there to make a difference. So I think the big change and the big breakthrough will be changing the service so it's a proactive service. So active. We know these effects, these cancer treatments have these effects. Let's get in early. Let's help people so we avoid some of the suffering that we can avoid. So we really need people to come to the service early. So I think that's the big change, is it's gone from being a really reactive service, waiting for people to have disability and then trying to help them through, to go, okay, let's see them early, let's be proactive, let's avoid the suffering and help people from the moment they get diagnosed with cancer have a better experience throughout the whole phase. Treatment's important, and cancer rehab is effective alongside treatment, and it can really help reduce disability.
Yeah, it seems there's a huge amount of research also into how to implement these into existing services. When there's an existing pathway like the cardiac rehab, you can almost use that as an example of a successful pathway as well, and really justify, cost, and sometimes what it comes down to as well, and benefit. It's there. It's just waiting to be acted, which is hugely exciting.
Absolutely. And I think you can also relate it to, stroke rehab and pulmonary rehab. We know we don't let a person affected by a stroke go home without a rehab plan. Nor should we let someone affected by cancer go home without a rehab plan. It's that simple. Everybody needs cancer rehabilitation.
No one should miss out. Like it. Where do you see cancer rehab going, and particularly maybe in this current climate, with COVID-19, the risk and immune suppression that is hugely common? Where do you see us going with it?
Well, I think that cancer rehab services, I've spoken to clinicians worldwide. Obviously, I haven't been able to travel this year, but I've seen the impact COVID has had on these services. But it's been really great. People have pivoted. People have changed the way that they're providing the service. And I think long term, this is probably a good thing. So I think there'll be a combination of face-to-face. I think individualized care is the number one most important thing for all people affected by cancer, that the service is individualized. So face-to-face care is important, but also you can do telehealth or sessions on Zoom. So, I think therapists have got a lot better at that because they've had to with COVID. And it's really effective in terms of helping people through this phase, particularly if people have to be isolated. So our therapists are still able to help people even if they are being isolated in their homes. And we found there's been quite good benefits with this, particularly if people are really deconditioned, really scared of leaving their homes. We can provide the service for them. We also do group sessions, and I think group sessions are vitally important for it to be cost effective, and the social element of groups is really important. We find that cancer can be really isolating. If people can join a group, they get really motivated and encouraged by other people in the group. When people understand, it's not just me that's been affected like this, it can be really reassuring for them. So I think the group element's important too. So we provide group, but if we're in a place where groups aren't allowed, we have been able to do that online. And again, it's been super encouraging because we've been able to help more people in this way. People that live really rurally, that find it too tiring or too hard to travel into the group sessions, are able to do it. Or people that work too much. So people go back to work full time, they're really, really busy, they don't have time to fit it in, but they're able to stream it live and do these classes. So I think there will be a combination of services, but I think the number one thing that it's always individualized. 100%.
I think like I say, we've had to pivot and adapt, and I think the application of the virtual sessions has been it's been incredible. It works because it is mainly exercise prescription. A little bit more has to go into the gathering subjective information and medical history in terms of screening and things like that to get that starting point. But once you've got that, it's really been effective. Particularly with the one-to-one. We haven't yet done some group sessions. I'm hoping we can start getting those going. But it's thank God for Zoom.
Yeah, no, absolutely. I mean, I think too, because of COVID, a lot of patients and people are getting used to that, using that platform. And also, a lot of the objective tests and subjective tests that we need to do, we can do that. We still can do that remotely. And I think that is an important thing in terms of cancer rehab is the patients are medically complex. They need to be triaged appropriately into the right services. And so that's why we make sure that in our training, we train experienced therapists like yourself, Fred, that we know are adequately trained to support these people appropriately, because safety is our number one concern. Obviously, we want to give people a good experience. We want to improve their outcomes. And so that triaging and that assessment is important. And it can definitely be done via telehealth if necessary.
In terms of, there's obviously a lot of variety around the world? I don't think this is the best worded question in the world, but it's where in the world would cancer rehab be done best? But I suppose it's more of what are the differences that you've seen across the world in terms of provision?
Oh, Fred, I'm going to have to be extremely biased here. Because I'm from New Zealand, I'd say New Zealand because it's a great country. No, but I think one of the things that we do here, obviously, I understand what we do in New Zealand better than some other countries because I live here. But I think one of the great things that I see here is our service provision. It extends the entire length of the cancer recovery or experience for someone. So we help people really early on in their diagnosis. We help people through treatment, which is fantastic. And then there's a number of services that we do after their treatment has completed. And the services are not necessarily in a room or in a gym. We also take people outside. So, we have events that we encourage people to do. We even do, and we do group things, but we also get people onto the water. So we do a paddleboarding cancer rehab program, which is just amazing to see people that are often very scared, unsure, even of the water, let alone paddleboarding on it, to being able to rehab and get the skills necessary to do that and then really enjoy it. So I think one of the things that the research is showing is that the effects of the treatment affect people for a long time. And people have a higher chance of getting things like cardiovascular disease, getting diabetes, getting osteoporosis from their treatments, getting a cancer recurrence. So there's a number of things that people need to realize that they are more susceptible of. But exercise, regular exercise, will help prevent these things. And so having therapists that can then help people maintain appropriate exercise levels or maintain that lifestyle change is really important. Not just seeing them in the clinic to get their arm moving, but actually help them get out of the clinics and back doing things. And what we find, with some of our programs that we do out in the community is they build bonds around them with other people. They start joining into regular cycling groups, regular running groups or whatever. So they go from being a cancer survivor to just getting out into the community. So it's helping transition them all the way, I think is really important. Not just in your clinic, but extending it. And I think we do that well in New Zealand. It's not perfect, but that's what how I think cancer rehab should be. It should extend the breadth of that experience and ensure people are actually doing healthy lifestyle choices to keep themselves healthier for longer.
It's a whole lifestyle shift, isn't it? Because going along happily, get a cancer diagnosis, and then you're into your treatment and sort of the medical world, and then it's how do we get back to that? This, may never get back to this, but it's a new normal, isn't it? It can be whatever that individual is motivated to achieve. Like, might never have thought about running the Great Wall of China Marathon, and then suddenly Lou James comes along and says, right, you're doing it. But it's the new normal, isn't it? And it's getting them, it's that bit of the pathway that then lasts a lifetime, hopefully.
Yeah, I mean, sometimes people have to modify what they were doing, but then, if you can teach them how you modify what they can do, which is good for them, what's going to keep them well. A lot of people lose, their balance gets really affected by their cancer treatment, or their upper body strength and those sort of things. And it's teaching them, okay, these are the things that you can do so you can get back to the biggest potential you have. And these are some of the ways you could do that. So it often is a shift or maybe a change. But then when people get into that and see that they can get benefit of it, it's really exciting.
Are there any major examples from care that you've seen around the world that either you've put into your practices, that you incorporate in the course, or that kind of we can learn from?
Can you ask that question again, Fred?
Is how the question was at the end. How can we learn from these examples, basically of the above? I don't know if you had any notes on that.
Yeah. Come to New Zealand, Fred, anytime. You're welcome. No, well, I think, one of the great things that we try and do with PINC and STEEL is our network of therapists work together to try and support each other. And I think that's cool. We can learn from each other, and it's a supportive environment. So I think seeing what other therapists are doing, what's working for them, how they've overcome barriers in their region, I think that's really cool. So one of the things that Pink and Steel tries to do is bring cancer rehab therapists together and support them so that they can provide these services and that they can support each other, because it's a challenging field. There's some challenging cases and there's some barriers that we've talked about. So having a group of people supporting each other is the most important thing. We're stronger together, Fred.
Nice. Amazing. Thank you very, very much indeed. It's a privilege to be able to talk to you. It's a privilege to be involved in the foundation and do what we can in the Midlands.
So if I can just say one last thing, Fred, it's all the best in the Midlands and for your work. I think you're doing a great job there. And, to everyone out there, medical treatment saves lives, but cancer rehab gives people their lives back. So thanks to people like you, Fred.
Nice. Thank you.